Hey, I'm Ryan, and today I'm going to be talking about the Xstat. The Xstat's a T-3C recommended device for controlling deep, narrow track junctional wounds in the groin and the axilla that are not amenable to a tourniquet. So there are two different types of Xstats, the Xstat 30 and the Xstat 12. One's for bigger wounds, one's for smaller wounds. The Xstat is a temporary device for use up to 4 hours until surgical care is required. So a few things that you need to know about the Xstat. It is not for use in the pleural cavity, the mediastinum, the thorax, the abdomen, the retroperitoneal space, the sacral space, tissues above the inguinal ligament, or tissues above the clavicle. Okay, so how the Xstat works is the Xstat 30. It's just a syringe, so all you're going to do is grab the plunger, pull back, set. Keep in mind that once it's locked, you cannot push the plunger back anymore. Insert the applicator into the wound as close to the bleeding source as possible. Once you meet resistance, simply push down on the plunger. If you meet more resistance, draw out slightly and depress the plunger. Do the same until the wound cavity is completely full. The Xstat contains compressed mini sponges. Upon contact with blood, the mini sponges absorb blood and expand to 10 to 12 times their compressed volume within approximately 20 seconds. A radio-opaque marker is embedded into each of the mini sponges to make them detectable by X-ray. Use additional applicators if necessary to completely fill the wound with mini sponges. Then apply a pressure dressing. If the bleeding is not controlled, simply apply direct pressure. And remember to document Xstat use and all patient care on a DD 1380.